Good day, everyone. My name is Dr. Lim Jo Ann. I'm a general physician and also a medical lecturer from the Department of Internal Medicine, University Science Malaysia. I would like to share with you guys on how to write a case report. The outcome of this lecture is to enlighten the purpose and the benefit of doing a case report, to understand the general approach of case report writing, and also to avoid common pitfalls in writing a case report. Just a brief introduction on case report. It is a detailed narrative that usually illustrates a diagnostic or therapeutic problem experienced by the patient. Why do we need to learn how to do case report? Number one, for exam, for our clinical work when we graduate, and also for publication. What are the benefits of doing case report? It trains one to recognize clinical questions and to look for answers by critically appraising with supporting literature. It also shares and disseminates educational experience and serves as an excellent preparation to one's medical and scientific career. There are many types of case report. It could be something rare or unique, something difficult, or something new or innovative. The general outline of case report for undergraduates consists of front page, history, physical examination, investigation, provisional and differential diagnosis, or problem list if there are multiple problems, management, the outcome of the patient, discussion will be the learning points, summary and conclusion, and also references. A case report should always be concise and complete, and it should be written in past tense. For publication, the general outline of case report should include abstract, introduction with citation, case report, discussion with citation, followed by conclusion and references. This is an example of a case report of an undergraduate. So for the front page, it consists of name, metric number, year of study, academic session, and supervisor. For history taking, we will include the biodata, the chief complaint, the history of presenting illness, systemic review, past medical and surgical history, drug history, family history, social history, and diet history. For the females, we will also include the past obstetric and gynecological history. And for the pediatrics, we will include the developmental milestone and immunization history. At the end of the history, we will include a short summary. For the biodata of the patient, it usually consists of the patient's name, reference number, age, gender, race, religion, occupation, address, date of admission, date of clerking, and informant. Sometimes we will also include the date of discharge and also the date and time of death. Bear in mind, if this is a publication report, the identity of the patient will be anonymized. For physical examination, we will include the findings from the general inspection, peripheral examination, specific examination, and other additional findings. We will also summarize all the positive findings and important negative findings into a short paragraph. For the investigation, usually we will first list all the various blood results, followed by urine results, sputum tests, ECG, and various images depending on the case, and other additional tests. Sometimes this investigation can also be listed based on the time. So for immediate investigation and followed by subsequent investigation. The management of the patient will subsequently be written in a chronological order from the acute, subacute, and long-term plan. If the long-term plan has not happened, it will not be written in the past tense. There are a few common pitfalls to avoid when writing case report. Number 1, always write short and concise story. Do not use present tense on things that has happened in the past. Sometimes it is better to use point form and diagrams to describe a long story. For images, always ensure good quality, proper orientation, and a clear description. You might sometimes want to use arrows to describe your figures. Always check for spelling and grammatical mistakes. Do not plagiarize or copy other people's work. Always get consent from your patients and maintain their confidentiality. And always have proper citation. This is an example of an undergraduate case report. If you see here, the chief complaint and the history of presenting illness are generally written in short sentences in short paragraphs. For systemic review, you can write it in point form and diagram. For other history, if the history is very short, short sentences and short paragraphs will do. However, if there are multiple data for that specific history, for example, drug history. If the patient has multiple drugs or medication, you might want to list it down in a bullet form. If this is related to an adverse drug reaction, for example, Steven Johnson, you might want to list down the drug in a chronology form from the past to the present. For family history, you can either describe it in a tree diagram or in a short paragraphs. If this condition is related to hereditary disease, then tree diagram will be more ideal. You can also extend it to include 3 or 4 generations down the line. At the end of the history, always write a short summary. It is usually written in a single paragraph. For physical examination, I would suggest writing it in point forms rather than paragraphs, because it gives the examiner a clearer outline on all the physical findings. The summary of the physical examination is usually written in one short paragraph. We only include positive findings and certain important negative findings. For provisional and differential diagnosis, it is clearer to write it down in a point form. For example, provisional diagnosis 1 followed by relevant finding towards it and relevant negative finding against it. This is similar to the differential diagnosis. For an undergraduate, usually 2 to 3 differential will be enough. For investigations, for example, full blood count, please state what was the rationale or the reason for ordering this test. What was the results of the test that you have ordered? And what is the interpretation of the above results? If we are writing about tests that involve images or diagrams, for example ECG, please include the images, ensure it is clear, proper orientation, followed by a good description. For discussions, it is generally written in short paragraphs. It is usually about the key points or the learning points from the specific case. Just a few take-home messages. Always keep an eye on difficult or rare cases. Aim to publish or at least a poster presentation. Always relate and explain your cases with proper citation. Use your own words. Do not plagiarize. Last but not least, always keep your article short and sweet but complete. I hope you enjoy this short video on Case Report Made Easy. If you find this video useful, please log into your e-learning and send me a feedback. If you have any further question, you can also email me at limjoanne@usm.my. Thank you very much and have a nice day.